So you're very welcome, everybody, to this informational webinar on the International Residency Training Programme in the Royal College of Physicians of Ireland. So you're very welcome. Thank you for joining us today. My name is Cliona Martin. I'm the Global Training and Partnerships Manager here in RCPI. And Katerina, if you just want to move to the next slide there. So today we have a lot of people to speak to, lots of important information. This is a big decision that you're making. You know, you're probably, most of you, in your internship, and you're thinking about your next step, and you have this great opportunity to travel overseas for training, which is, you know, going to be great on a professional, but also on a personal level for you. So today, as well as myself, we're joined by Katerina Praskova, and she's going to talk to you about the individual programs and the application and recruitment process. And then we have Adam Lacumber, who's going to speak to you about the onboarding. And that's when you've accepted your offer with us. Adam looks after you then in helping you through all the milestones to actually arrive here in Ireland as well. And then we have Denise Healy from Castel Education. Now, some of you, if you have any friends that have trained with us, have probably heard of Castel Education. They do a wonderful job supporting you with lots of the things, getting you to Ireland. And then to talk about our individual programs, we have Professor Danny Cherian for the Internal Medicine Residency Program. We have Prof. Michael O'Neill to talk about Paediatrics. We have Professor Cecily Quinn to talk about the International Basic Specialist Training in Histopathology. And then finally, Dr. Azrini Khalid to talk about one of our new programs in Obstetrics and gynaecology. Now, throughout this session, I'm sure you'll have lots of questions as we go on. Please just type them into the chat or the Q&A box at the bottom. We will answer some of them in real time. You know, Anton is here working away, typing answers, but some of them we'll keep and we'll answer at the end, especially if they're questions directed to any of the professors or doctors here today. I'd just like to say also, this program is, you know, really only open to doctors from Saudi Arabia. We are very close to signing an agreement with Bahrain and Qatar, so those countries are eligible for that as well. So they're really the main countries that this is for. Okay, so you can go to the next slide, Katerina. So I'm going to talk first of all a little bit about Ireland. For those of you that have not been to Ireland before, what I always say, a lot of people have been to the UK, very similar. But what I always say is the Irish people are way nicer here. So you'll have a good time in Ireland. It's very well connected to the rest of the world. So, for example, it's less than an hour of flight from Dublin to London. But also what lots of our trainees actually do, they use their training in Ireland as a stepping stone to the rest of Europe for little weekend holidays, you know. So you can get flights to Paris, you know, Rome, things like that are quite short and very affordable to see, you know, the rest of Europe while you're doing your training. Something that is very important as well is the accessibility to home. You know, you're going to be here for 2 to 3 years. And, you know, family, I think in your culture and the same as Ireland, family is very important. And you don't want to miss out on those big occasions, family celebrations and things like that. Dublin to the UAE, the flight is about 7 hours. So it is very accessible, you know, to get home if there's any events on, or maybe if you're just, you know, missing your family and friends for an occasion as well. You can see there from the picture the green hills there, or cliffs. If any of you have seen Harry Potter, that might look familiar. They feature in the Harry Potter movies. But it is very green, and that's because we have quite a mild climate here. So the average temperature is about 10 degrees. It never gets too hot or too cold. Now, myself and Katerina were in Saudi Arabia and the rest of the Gulf last month, and it was very, very hot for us. It was up to 40 degrees in some places. It's not like that in Ireland. So a lot of our graduates actually say to us, you know, Cliona, when I was in Ireland, it was the healthiest I ever was because I could walk to work, I could walk to meet my friends. So it's just a different kind of lifestyle while you're here as well. Now, Ireland does have its own language, Irish. You know, we all learn it in school, but none of us speak it very well. So English is the spoken language. Nobody in a hospital will try and speak to you in Irish. The only time you will see Irish written is in the street signs the names of roads and things will be in Irish and English. Another important thing is, that you need to consider when coming to a new country is, how friendly and safe it is. So Ireland is, we have a reputation for being very friendly and welcoming, and it is true. Many of my friends who are not Irish, when they first arrived here, they said they'd have their map, or their Google Maps on their phone, and it'd be a few minutes or a few seconds, and an Irish person would come to them and say, "Are you lost? Do you need some help?" And that does happen. I do that to people when I see them a bit lost. So it is very friendly like that. And also Ireland is ranked number 2nd in the Global Peace Index for the safest countries in the world. So it is a very friendly and safe and welcoming country. Very small, about 5 million people, and really very important for all of you today. It is internationally recognised for excellence in postgraduate medical training. So our programs are recognised as Tier 1. So when you return home, you'll go into a senior registrar post or be ready to take that next step to fellowship training. Also, something important to mention is, our programs are recognised globally. So I'll give you an example. We had a doctor who did the Paediatrics residency program, and then she went on to do her fellowship in sick kids in Canada. And that was because, our programs are so highly regarded and recognised globally. Okay, so for those of you that have not been to Ireland, we have a very short video just to give you a little taste of Ireland in 60 seconds. So Katerina will play this now just to give you a little flavour of the country. Great, so a little bit about RCPI. RCPI was founded in 1654 by that gentleman there, Dr. John Stern. And since the foundation and up until today, really at the core of what we do is to improve medical education and patient care. And it is the professional body for all training across our 6 faculties and institutes in Ireland. And, just a nice little piece of history for any of the ladies joining us today. And the first registered doctor was Dr. Eliza Walker Dunbar, female doctor, sorry, and she passed the RCPI exams in 1877. Okay, so our vision, and this isn't just something we have on our website that looks nice. It's really true. So our vision is to create a global community of doctors engaged and enabled to improve health. So this is very important because those 2 words, global community. You don't just come here and do your training and that's it, bye, off you go home. You're training with Irish doctors, you're in a team with Irish doctors training together, following the same curriculum. You'll have a lot of access to your trainers and consultants. You're going to build these professional and personal relationships that will be with you, especially the professional ones, throughout your career. So, it is really, it's not just, 3 years of your life. These connections are going to be with you throughout your career. So something that's very important and very unique to Ireland that you won't find if you're training elsewhere is the support we offer. So I'm going to just touch on it now a little bit, but Denise will talk about this in more detail and how it works. So first of all, for English language, if you do not have your English language at time of application, but we can tell that you're a good doctor and you will do well, we will give you a conditional offer, and then we will give you free one-to-one private tutoring to help you prepare for either the IELTS or OET exam. We also offer tutoring for the RCPI exam as well, for those that need it as well. We have relocation support, and we have to be very honest, accommodation is quite difficult in Ireland. That's why Denise and her team help you find accommodation. We also help with, if you are coming with children, finding schools, things like your registration with the Irish Medical Council, your work visa, even opening a bank account, like from the big to the small things, we're there to help you. There's a dedicated program coordinator and program management team when you arrive, and they're helping you with all, your rotations or any things like that, or any questions you have. Then there's the clinical aspect. There's a dedicated program director and associate director, and they're covering the clinical aspect of your time here, making sure you're meeting all your requirements and you're doing well. And we also have health and well-being, and this is for both our Irish or national trainees and our international trainees, because sometimes life can get a bit complicated or difficult, and you might need a little bit extra support, and we are there to help you with that as well. So the program director designs the curriculum. So this is a structured training program. So you are training in busy Irish hospitals. It is not an observership. You are working in the hospital and following your curriculum as well. Your trainees will help you, will guide you through the curriculum and also provide any support. If there's anything specific that you're very interested in, maybe ensuring that you get a rotation in that or get exposure to it as well. And really the program director not only is looking after you, but they're also making sure that the trainers training you are getting on okay as well. So I touched on the tutoring for the MRCPI. Now for our program in internal medicine and paediatrics, you must have part 1 of the MRCPI, that's our membership exam. So part 1 of that in order to start in the post. So if you do an interview and you're successful, you get an offer, our tutor will then guide you and help you to prepare for that exam. And that exam, there's probably 2 to 3 sittings a year. And it is very, very important that as soon as you get an offer, or even beforehand, you are preparing for that exam and registering to take it. Many people don't get it first time. It might take you 2 to 3 times to get it. And that tutor will, give you access to question banks and things like that and really guide you through it. For those of you that are interested in the residency in obstetrics and gynaecology, you do not need to do an exam. You need to do an online diploma with IHED, and we'll speak more about that throughout the webinar. And then the next slide, I'll pass over to Katerina, who's going to speak a bit more about the individual programs and the recruitment progress. Okay, I'll just encourage anybody, if you have any questions, just pop them in the question box. Thank you.
Thank you very much, Karina, for these introductions and talking about the RCPI and Ireland. So very warm welcome for all of you from my side. I'm delighted to have you here with us and learn a little bit more about the international residency training programs with Royal College of Physicians of Ireland. We are delighted also to have here all 4 clinical leads for these residency programs who will shortly introduce you to the programs in more details. And also Dennis from Castel Education and Adam, our colleague from admissions teams. So I will just move on and play firstly this video. The main person over there is our Dr. Talal Zahrani, who is our international fellow in Paediatrics respiratory program. So he is already undergoing his fellowship training over here under supervision of Professor Desmond Cox, who is the clinical lead for pediatrics respiratory, but also he is his trainer. And you can just like sense the vibe and the energy throughout the video of Dr. Talal's work and also life in Ireland.
Good morning, I am Dr. Talal Zahrani. Welcome to a typical day of my life here in Ireland.
It's an early start for Dr. Talal as he prepares for a busy day at Children's Health Ireland. A short walk from his new home, He begins his day with a sense of purpose and dedication to patient care. Dr. Talal makes his way through the vibrant city of Dublin, the capital of Ireland. Dublin is a safe and friendly city with lots to see and do. At Children's Health Ireland, Dr. Talal is part of a supportive environment where collaboration and teamwork are at the heart of patient care. After a busy morning with patients, Talal meets with his trainer, Professor Des Cox, and other consultants, who ensure he gains experience and exposure to a range of medical cases. Beyond the hospital walls, Talal enjoys moments of respite, savouring the rich culture and making friends in his new home. A day in the life of an international fellow is a tapestry woven with dedication, compassion, and a commitment to making a difference. Dr. Talal is working toward a brighter, healthier future, gaining important experience and skills to bring back to his home country.
So this was just a little taste of the training in with the RCPI, and now I just would like to I just move myself a little bit on the other side. I just would like to say a couple of information regarding the training with the Royal College of Physicians and what's there really for you and what you will going through if you decide to train with us. So as Klina mentioned, the programs are fully accredited with overseas health authorities. So if you come and you take the residency programs with us and you will come back to your home country, you will be able to apply for your senior posts in your specialty. And also, as mentioned before, if you complete the residency over here and you feel that you would like to explore more training outside of Ireland and your country, maybe perhaps in Canada or UK, our programs are fully recognized over there as well, and you will be very welcome to join the fellowships programs overseas as well. So if you come to train to Ireland, you will be based in the busy Irish hospitals, and all our trainings are hands-on clinical experience. So be aware that it's not observership. You will be dealing directly with the patients and also with their families, and you will be involved in the multidisciplinary teams as well. You will be rotating throughout the Irish hospital, mainly in our main Irish cities like Dublin, Cork, and Galway, and perhaps in some smaller cities like Waterford or Wexford. And you will be rotating in different specialties. However, in each rotation, you will be supervised by the designated and RCPI certified trainer who will look after you and guide you throughout your training. You will be also involved in the multidisciplinary clinical team. So the main thing with our training is that you are joining together with our national trainees and you are training together. We don't do any separation, that you are international fellows and you have your rotations and national trainee and they have their rotations. No, you're one team, you're training together, you're getting the same clinical exposure and clinical experience, and you learn and help each other. You can get familiar with the curriculum already, and you will receive the curriculum as well if you're successful at the interview. And if you join the program, the curriculum actually mirrors your logbook. So you will have the online logbook as well. We call it e-portfolio. And once you start training, you will be logging into your e-portfolio and just ticking off all your experience and exposure that you get. And this logbook is really important as well because you will need it for your quarterly and annual evaluations. So you will have quarterly evaluations to see with your trainer to see how you're progressing throughout the year. And at the very end of the year, you will have like a little bit bigger annual evaluation, and it will go through your training progress throughout all the year. So at this evaluation, it will be your clinical lead, your trainer, somebody, your program coordinator from RCPI, and yourself. And you will just talk about the experience throughout your year, what went correctly, what was your great experience, and on the other hand, where you actually need to gain a little bit more exposure or where would you like to go in your next year. Important thing is that throughout your training, you will need to attend your study days and mandatory courses. You will get free dedicated day to attend these study days and mandatory courses, and they are all free of charge. So it's really highlighted that you attend these courses. Also, research and audit, they are very important throughout your training as well. So you will get definitely the time to do your research or audit, as you may call it, quality improvement, and you will get good exposure to these as well. So our institutes and faculties, so we actually have 6 institutes and faculties, but for the residency training, we offer 4 programs, and it will be within the Institute of Medicine, Faculty of Paediatrics, Institute of Obstetricians and Gynecologists, and Faculty of Pathologists. And as I mentioned before, we are very lucky to have all 4 clinical leads for these programs over here, so they will talk in depth closer in depth about all the programs. So I just mentioned very quickly that general internal medicine and pediatrics are the longest programs over here. We offer these programs over a decade now, and we were very happy to introduce the obstetrics and gynecology and histopathology last winter, and we are experiencing good interest in these already. So just to mention about the general internal medicine, that it's a 3 years program, and you will receive the comprehensive training experience throughout in the Dublin-based hospitals. And at the end of the general internal medicine, you will need to complete your MRCPI exam to receive the certificate of achievement at the end of your training. With the pediatrics, so it is also 3 years in durations, and you will receive senior clinician mentorships, and you will learn in depth about general pediatrics and its subspecialties. And again, as with the general internal medicine, in pediatrics, you will need to complete the MRCPI fully, that you receive the certificate of achievement at the end of your training. With the obstetrics and gynecology, you will receive the comprehensive training and well-rounded exposure in improving women's health. So this program is 3 years in duration as well, and you will need to complete the MRCPI exam as well to receive your certificate of completion. And for our international basic specialist training in histopathology, that is 2 years in duration, and you will get the exposure in modern healthcare with a wide range of subspecialties and teaching. So this is very important slide for you, and the next 2 slides are actually really important. So I will talk about the entry requirements and also the specialty-specific entry requirements too. So in general, if you're applying for the programs, you need to complete a primary degree through English. You will need to have completed or be near completion of structured internship. So if you are just in your internship, let's say you will finish in June 2026, don't worry, you can still apply. However, just mention the date of completion of your internship in the application. And also you need to have an appropriate level of clinical experience. So once you apply and you go through the interviews and you receive the program offer and you accept it, you will need to complete your English language exam if you haven't done so far. So as Karina mentioned, we will give you a one-to-one tutorial to complete this English language exam, and Denise will talk about it a little bit later on. And you will also need to provide us with your sponsorship by your government body or your institute. So important specialty-specific entry requirements. So as you can see, for general internal medicine and pediatrics, and Karina mentioned it before, is MRCPI or UK Part 1 written, and you need to complete this prior start the post. It is important also to say that you can take the exam for general internal medicine 6 months after completion of your medical degree. And for pediatric medicine, it is 18 months. So just bear this in mind when you're applying, that there is a time restrictions when you can take the MRCPI Part 1 written. Also, if you are successful at the interviews, we will provide you with a one-to-one tutorials and access to a question bank to prepare for this exam comprehensively. So it's really important that you are in touch with Castel Education after your program offer and you prepare for these exams thoroughly. So for obstetrics and gynecology, you will need to complete the IE diploma in obstetrics and gynecology prior to the start of the post. Bear in mind that this diploma takes 9 months to complete. And I believe, so if you are applying now, consider actually to sign up for this program now. I believe that there are slots for June 2025, starting in June 2025, because it takes 9 months. So for starting July 2026, you will need to join this program as soon as possible. So, and I will go quickly through the recruitment process, but firstly, I would like to play this summary video that will take you through our application and onboarding process, and then we will talk about it a little bit into more details afterwards.
The process of joining one of RCPI's prestigious international programs couldn't be easier. When you're ready to apply for one of our residency or fellowship programs, you can start your application online and through our website. For residency, you need to have completed your degree through English, completed or be near completing a structured internship. For fellowship, you need to have completed a primary medical degree through English, completed a structured internship, completed a national residency program, and passed the associated final board examination. For both residency and fellowship programs, you will require provisional sponsorship from a government body we have an agreement with. Remember, you don't need to have an English language certification or MRCPI to apply for either program. Make sure to submit all required documents correctly. And if you have any queries, just reach out to the RCPI team and we'll be happy to help. If your application is shortlisted, you'll be invited for an interview in one of the Gulf Cooperation Council countries. Successful candidates receive an offer within a few days. Officially accept your offer by email. The RCPI team, along with Castel Education, will support you right through onboarding into the program and training itself. If you need to meet English language proficiency requirements, we offer one-on-one tutoring to prepare for the OET or IELTS examinations. For those joining the residency program, RCPI tutors will provide tutoring and access to a question database for the MRCPI Part 1 examination. RCPI and Castel Education will help you register with the Irish Medical Council, visa applications, and finding accommodations, schools, and childcare. We even assist with everyday tasks like opening a bank account. You will arrive in Ireland 2 weeks before your start date to settle in your new home, attend an induction day, and then begin your journey to advance your medical career in one of our Irish hospitals. Graduates from the Royal College of Physicians International Residency Training Program and International Clinical Fellowship Program have gone on to achieve the following roles and advancements in their careers. Apply to an international program with RCPI today.
So as you could see in the video, we provide a lot of support for you to actually come over here to Ireland and train with us. And you can literally apply for the residency program today because the applications are currently open and they will be open until Sunday, the 8th of June, 2025. So at that date, the application will close. And I just would like to mention about the application. Once you're applying for the program and you're completing the application, please make sure that you take your time to complete the application fully. List all your experience, your skills in the desired specialty, any research or audit, put it all in the applications, all your leadership or other trainings you made completed. So put all in the applications, because the clinical leads will review these applications as well. So they need all this information to make the right decisions to shortlist you, to move you forward through the process. So once the applications closed on 8th of June 2025, myself and our colleague Anton we will be verifying the applications, and all the verified application will be forwarded to the clinical leads for shortlisting process. So the clinical leads, they will complete the shortlisting and they will review the application through the clinical side. And if you are shortlisted, you will be invited for the in-person interviews. And this year they will be held in Dubai at the beginning of September. So after the interviews, if you're successful at the interview, you will receive the program offer within the 2 weeks. And if you accept the program offer, you will be transferred to my colleague Adam, who will start onboarding process with you. So I will hand you over to my colleague Adam now, and he will talk you through the onboarding process now. Thank you very much.
Thanks, Katarina. Hi, everyone. I hope you're all doing well. My name is Adam, and I'm the International Admissions Coordinator within the RCPI admissions team. So my role essentially is to support the onboarding process for our international candidates onto the International Residency Training Program while ensuring a smooth transition to Ireland. So on the next slide, we have a very simplified outline of the onboarding process. The overall goal here really is to help you progress through each stage of the process over a 15-month onboarding cycle. So the first stage of the process is the one-to-one onboarding meeting, which really is an opportunity for me to introduce myself to our candidates, outline the process, and establish myself as the primary point of contact throughout onboarding. The one-to-one meeting also gives candidates an opportunity to ask any questions you might have as you embark on your training journey with RCPI. Once we've been acquainted, I then refer you to our brilliant colleagues in Castel Education, who will provide tailored tuition to help you meet our English language requirement if you haven't already done so, and also assist you with your EPIC verifications, your Irish Medical Council application, your visa application, sourcing accommodation, and finding suitable childcare or schooling for your children if that is required. At this stage, I'll also refer you to an RCPI clinical tutor who will help you prepare for the MRCPI Part 1 examination. Following this, the next step is to liaise with the program directors who are on the call today, who will confirm your Year 1 clinical placement or hospital allocation. This is confirmed well in advance of your program start date to give you enough time to secure accommodation in your allocated training area. Once each of the above steps have been complete, we can then apply for your work permit under the atypical working scheme, which is needed in order to take up post here in Ireland. RCPI will apply for this on your behalf. There is a significant amount of paperwork involved, but I'll be there to guide you throughout the process. Coming towards the end of the onboarding process, Castel will then assist you with your entry visa, while also advising you with regards to travel plans from the Middle East to Ireland. Provided the candidate successfully moves through the onboarding process and has arrived in Ireland, you'll then be handed over to my colleagues in the international training team, who will support you throughout the duration of your training program in Ireland. So thanks very much for your time. I'll now hand you over to Denise from Castel Education, who will speak more about the range of supports on offer.
Thank you, Adam. I'm going to share my screen. Good afternoon, everybody. My name is Denise Healy, and I'm Centre Director of Castel Education. I'm delighted to speak to you in this session about the services that we provide to incoming RCPI doctors. So we have worked with the Royal College of Physicians for over a decade, supporting doctors coming to Ireland to ensure that all their needs are met in relation to relocating. So in this session, I'm going to give you some information about the English language requirement for the Medical Council in Ireland, and some English language information on the tuition we provide for doctors who have not yet met their English language requirement to register with the Medical Council. I'll give you an overview of the typical doctor journey with Castel from start to finish, and some pre-arrival and in-country support that we provide. So this is a unique service that is complementary to RCPI doctors. So it's really wonderful, free of charge, and I don't think any other country in the world provides such a level of support as this. So doctors feel very privileged and well taken care of when they accept their offer to transition to Ireland. So the first step in the Medical Council application is to ensure that you have your English language requirement. The Medical Council in Ireland accepts these two exams. The first one is IELTS. This is an international English language testing system. It's an academic exam. So doctors need to have an overall 7 with no skill less than 6.5 in this exam, and it has to be dated within 2 years. And as my colleagues mentioned already, doctors can receive an offer without the English language. It's a conditional offer, and then we work with them to ensure that they meet their requirement. The other exam that's accepted by the Medical Council is Occupational English Test. And again, this has to be dated within 2 years of receiving your offer. And the minimum grade in each skill, listening, reading, writing, and speaking, is a B in that exam. These two exams are very different in nature, equally challenging. So a doctor chooses one that suits them best. The IELTS exam is very academic orientated, and the OET is focused on medical terminology and mostly suited to doctors and their careers. So in the past few years, we have experienced doctors choosing OET over IELTS. So on the right-hand side of this slide, you see the mode of exam that is accepted by the Medical Council. So in IELTS or OET, it is only the paper-based exam in Centre or the computer-based exam in Centre. So a doctor needs to physically present at an official exam centre to take one of these exams. So the mode of exam that's not accepted is an IELTS or OET online at home, or a one-skill resit. So many doctors who were referred to us may have taken either exam in the past and they have a deficit in one skill, and they ask to repeat that skill only. And unfortunately, that's not accepted. A doctor needs to meet all 4 skills in one sitting. So as I mentioned, in the IELTS exam, an overall 7 is required. And to receive this average, a doctor needs to get a 6.5 in 2 skills and a 7 in 2 skills to get that. And that is a proficient advanced level of English that is required. If a doctor has 6.5 in all 4 skills, they have an overall 6.5, which is not the requirement. And in OET, the requirement is a B in each skill. So that level of linguistic ability equates to this on my screen here. So doctors are required to have the capability to communicate effectively with patients and healthcare professionals using appropriate register, which is formality in language, tone, vocabulary, and show a good understanding in a range of clinical contexts. And that's a proficient advanced level that constitutes a B in OET or an overall 7 in IELTS. So as I mentioned, OET is the exam of choice for medical professionals, and doctors tend to meet their requirement faster in OET compared to IELTS. And there's a lot of research that has been done in this area that the OET is a more suitable exam for doctors. So It is available for 12 professions. So when doctors go to book this OET exam, they choose the medical version of the exam. The productive skills of speaking and writing are unique to the profession, but the receptive skills of reading and listening are common to all 12 professionals, but again, based on generic medical and allied health language. So a typical trainee journey with us, a language journey, when a doctor is referred to us and they have not yet met their requirement, we have a welcome meeting. We introduce both exams and the differences of OET and IELTS. We decide which exam suits the candidate best. We establish their level. We gather information on the preference of exam, maybe an exam date they've booked, and we devise a learning journey for that doctor. We refer the doctor to an expert tutor. All of our tutors on the team are IELTS examiners or OET interlocutors. We sign the doctor up to a specific learner management system where they have access to lots of practice tests to prepare them for their exam. And this tutor schedules one-to-one classes around the doctor's schedule prior to their exams, because we're very much aware that doctors have busy schedules, many are on call, so our tutors are flexible to schedule classes around the doctor's schedule. So we do initial diagnostic assessment where we determine the level or any gaps, linguistic gaps, or the skills that require most attention. We monitor progress of doctors and we provide a correction service, speaking practice, and we give feedback on a regular basis to RCPI on the English language progress of each doctor. When a doctor meets their requirement, they're referred to the relocation team and they work through the steps on transitioning to Ireland. And if a doctor doesn't meet the requirement in their first or second sitting, we continue tuition until they meet their IELTS or OET requirement. So typically, if a doctor has met their IELTS or OET requirement, they're referred directly to the relocation team. And if a doctor is short in one skill, listening, reading, writing, or speaking, we recommend a minimum of 6 weeks one-to-one tuition. If a doctor is short in 2 skills or does not have any IELTS or OET experience, this is okay because we work with them to build up their skills, and we recommend a minimum of 8 weeks one-to-one tuition. So the majority of the doctors meet their requirement, they're very ambitious, they're determined to transition to Ireland, and they commit to the materials that are provided, to the one-to-one classes, and really the overall learning opportunity of having that guided one-to-one tuition is amazing for doctors who will be working in an English-speaking country in the future. So a timeline for relocation to Ireland. So again, the IELTS and OET can take 6 to 8 weeks to meet, and then a doctor moves on to the Medical Council registration, and the first step there is EPIC, Electronic Portfolio of International Credentials. So that is getting your credentials approved via a system, and that can take 4 to 6 weeks. When that is complete, the online application for the Medical Council is started. That can take 4 to 6 weeks. And then the atypical working scheme that RCPI contribute to can take 2 weeks. And then the visa application, depending on which country in the Middle East you're based, it can take up to 4 weeks. So there is a timeline associated with all of these steps. And then when you have your visa, we give advice on flight planning and in-country supports that are offered after that. So a summary of Castel supports. So the online English language tuition is a step 1. Then the Medical Council registration, we have a team that give you guidance on the process that's involved, including EPIC. We review all of your application documents, including draft application and notarization guidance. We review the certificate of good standing also. And then when all of the medical council registration is complete, we give advice and guidance on immigration services. So visa application, family visas. If a residency doctor is traveling with their family, we give advice on how to apply for your family visa for Ireland. When you arrive in Ireland, the Irish residence permit is a substitute for your visa. So we give guidance on how to apply for that and the documents that are required. And on many occasions, doctors travel to other countries in Europe, the US, to attend conferences, and they may require third country visas, and advice again is supplied on that. While a doctor is still in their home country, we give advice on accommodation in Ireland, and we work with them before travel and also post-travel. So we get their preferences on temporary, permanent accommodation. We liaise with state agents prior and post-arrival. We arrange viewings. We give advice on the paperwork that's required to submit applications, and we review any lease a doctor is going to sign, and we give advice on moving in procedures and setting up utilities in your home in Ireland. If a doctor is traveling to Ireland with their spouse or their children, we give advice on schooling and childcare, and many occasions the accommodation, schooling, childcare, and a hospital base, they're all interlinked to find suitable in close proximity settings. So we establish education requirements of children. We contact schools, childcare facilities to establish availability prior to arrival, and we forward suitable options within Ireland for consideration. So upon arrival, each doctor and their family are picked up from the airport. We transfer them to their temporary or permanent accommodation. A personal welcome information pack is given with all the information you need about setting up, living, and immersing yourself into Irish life and culture. There is an out-of-hours support service available in case of an emergency or any immediate advice a doctor requires. There is a post-arrival welcome call, and then we give advice on settling in to Ireland in relation to banking, mobile phones, utilities, setting up internet, TV within your household, health insurance, car rental if that's required or purchase, driving license if required, and your PPS number in Ireland. And then there's lots of ongoing information that is provided to doctors on a daily basis. If they want to know any information about local public transport, student leap card, health centres, GPs that is close proximity to their accommodation or work setting, local prayer facilities and ethnic food shops wherever they live in Ireland. So this is an overview of the ongoing support. It's an amazing service provided by RCPI to ensure doctors that can transition to Ireland focus on their academic setting up and working while everything else is taken care of. So if you have any questions, this is my email in relation to the relocation supports that are offered. So I will hand you back to Katrina, the host. Thank you.
Thank you very much, Denise, for this in-depth information about the supports. And now I would like to welcome our Professor Dennis Sherian, who will talk about the International Residency Training Program in General Internal Medicine. Professor.
Thank you very much. You're all very welcome here. Thanks for joining us. I'm going to share my screen, and hopefully this will work. Okay, so you're all very welcome here. I'm, as mentioned, Danny Charian. I'm the program director for the internal residency program here with RCPI. I'm also a gastroenterologist and I work in Beaumont Hospital and RCSI University here in Dublin. So I thought it might be helpful just to get a very brief overview of what Irish training is like in general. So much in the same as it will be for yourselves as an internship after graduating medical school. This is 1 year and generally consists of medicine and surgery. And these are obviously, these doctors are called interns. Following on from that, we have our BST candidates, or basic specialty training. And it's generally the last 2 to 3 years. In Ireland, we call them senior house officers or SHOs. These are the equivalent of residents abroad. And the goal for this, as it will be for those people interested in coming here to train in medicine, will be to complete the MRCPI. Following on from that, in general, medical trainees here will go on to higher specialist training, or HST, which is in general an average about 5 years. And these doctors are called SPRs and are admitted onto the program via competitive interview. Following on from that, and whether or not they do research or fellowships, etc., they are appointed on to become consultants. So generally speaking as well, most doctors here will also complete a postgraduate research degree, either a medical doctorate or a PhD, during their higher specialist training. And then, as mentioned, a lot will go on to do fellowships, either within Ireland or abroad, to gain extra subspecialty expertise prior to a consultant appointment. So it's quite a long journey. In general, it's somewhere between 9 to 10 years after qualifying from medical school. This is where you will fit in as the international residents. It'll be alongside our BST candidates or the SHOs. So a bit more detail about the International Residency Program for Medicine. So as mentioned, it's a 3-year program. It's now being conducted in Dublin, and it'll be 18 months essentially in a level 4 hospital, which is what we call a tertiary referral hospital, and 18 months in a regional or level 3 hospital, where there'll be more of a flavor for general medicine. We put here that all trainees have to complete at least 3 out of the 5 core internal medicine rotations, but in truth, all of these, it's extraordinarily unusual that trainees wouldn't go through all of these core rotations, including cardiology, endocrinology, GI, medicine for the elderly, and respiratory. It would be the expectation really that trainees going through their 3 years will also be working under renal, neurology, stroke medicine, microimmunology, ID, rheum, oncology, hematology, dermatology, and there's also options for more dedicated specialties like clinical pharmacology. So there's a wide exposure to both core and more subspecialty type medical experiences here. Finally, we do also offer the opportunity, depending on the candidate, the hospital, and availability, to do a type of elective for the last couple of months of their program. This is an elective really within their specialty of interest. For example, if they're particularly interested in nephrology and have already done a renal rotation, we may be able to facilitate a second nephrology rotation as part of an elective. It is the absolute requirement that MRCPI is completed in order for you to get your certificate of completion for the internal medicine training here with RCPI. So hospital life, sorry, I'll just move this along here. The team structure, as I mentioned, is generally led by a consultant, and the person just under the consultant will be the specialist registrar, followed by the SHO or international trainee, supported by the interns. In general, life in the hospital here is probably very similar to what you've experienced there as well. There are daily ward rounds. Patients obviously need to be seen, examined, and appropriate notes documented. A lot of the differences that you might encounter will be to do with social issues that people may come across. For example, discharge challenges, nursing home issues, things like that may not be as common in the Middle East. So we are very heavily dependent on a multidisciplinary team of occupational therapists, physiotherapists, and medical social workers. These are all allied health professionals that really help to look after patients and both are involved during their care, but also to facilitate their discharge and post-discharge issues as well. There are generally formal consultant ward rounds at least 3 times a week. Usually now it's every day, at least to see some of the new patients or the sick ones. And these are particularly to review the 6 deteriorating patients, review the labs, radiology, and to flag discharge issues. And these are the times where we get to see how you are performing, to see, do you know the patients well? Are you coming up with appropriate management strategies, and how you're progressing with your medical knowledge? A couple of terms that you may come across. One of them is scheduled care. These are essentially planned visits to the hospital, outpatient clinics, day centers, for example, and procedures such as coming in for echoes or endoscopy, etc. And unscheduled care, which is a large part of the work in the hospital and a large part that will contribute to your training. These are basically when teams are on call for the emergency department or unselected take, people referred to medicine, and these are generally very busy services. I was on call last night, and we had nearly 50 admitted patients for medicine coming in through the door. So these are busy, but great training opportunities for you guys. The team was responsible for admission until discharge to the GP, and of course, depending on the hospital, we do try to delegate the patients to their appropriate subspecialties. For example, a diabetic ketoacidosis will generally go under the endocrinology team, GI bleeds under us, etc. So in terms of how to make yourself look good, how to make yourself look attractive, and what is a standard application, most of this is very common sense. A structured, well-designed application without spelling mistakes, and an application that's designed for what you're looking for. For example, making sure that you've got an internal medicine application, not accidentally putting in a pathology application when you're putting in an application for the residency program. All the supporting documents need to be attached, as previously discussed. It's very helpful to have a demonstration that you've actually shown an interest in your chosen specialty, that you've done elements of medicine, that you've had some experience in chosen specialty of medicine prior to application. That may not always be possible if you've only just completed an internship, and of course that is taken into account. Research, any type of research, whether it be a poster or a local presentation, is always valuable to put on at this stage in your application. Any evidence of audits or quality improvement studies shows that you are active within your unit, within your hospitals, and that you show an understanding for the importance of research and audit. As this was alluded to before, MRCPI is critically important, and I think it's very strong on an application if an individual has certainly passed part 1, but even attempted the part 1 shows a real dedication that they are truly interested in coming to join us in our program. Well, what I would consider a great trainee as time goes on is an individual that's not only highly motivated, but really self-motivated. People that we see coming to us with ideas, presenting on ward rounds, presenting management strategies, looking for feedback, really committed to patient-centered care, which is always challenging. These are busy lists, busy schedules, but once again, fantastic training opportunities. I always think a great trainee is one who integrates well into the team and into the hospital, is showing that they're maybe getting into parts of committees, integrating well with other colleagues and the allied health professionals. I think it's great for a trainee to be up to date with medical literature, showing that they're current, that they're reading journals, that they're not just studying for exams and showing up to work, but they're showing that they're trying to advance their medical knowledge in general. And ultimately, this is what it's about. You get your training, you get your MRCPI, you're a member of the Royal College of Physicians. And then ultimately, what we like to see is that you're a future ambassador for RCPI. You're a great standout beacon for what we like to think is a great training program. And we hope that you coming through our program will bring the experience, training, and the skills to really lead the way in your local hospitals and local jurisdictions. So I'll finish with that, and I'll stop sharing my screen, and I'd be happy to take some questions at the end. So back to you, Katerina.
Brilliant. Thank you very much, Professor. I will just share my screen back. And I would like to welcome Professor Michael O'Neill, who will be talking about the International Residency Training Program in Pediatrics. So on to you, Professor.
Thank you, Katerina. And I would like to echo Danny's comments because they're exactly the same features that we are looking for in pediatrics. So what I would do this morning, I thought I would just tell you a little bit about the pediatric program. So it is a 3-year clinical program, and it's somewhat different from the internal medicine. The first for us training people in general pediatrics is important in that they have a broad exposure to what we call undifferentiated illness in childhood, which is quite tricky to deal with, and it takes a significant input of large volumes of cases to get those skills. So the first 8 months is spent in general pediatrics outside Dublin, and this will incorporate some neonatology. And then a 4-month period will be spent in Dublin then in one of the tertiary care neonatal units, where you'll get a 4-month experience in neonates, looking at the well neonate, and then some time in the intensive care units. And in the second year, there will be 4 3-month rotations in subspecialties. So for us, neurology, metabolic medicine, respirology, and endocrinology or gastroenterology are what we call the big 4. We incorporate these specifically because in the rotations outside Dublin, you'll get exposure to pediatricians who have an interest in cardiology, so we no longer include it within our major grouping. In the third year, there'll be an opportunity to pursue a 3-month subspecialty elective in Dublin, and this really is giving you an opportunity to look at a specific exposure to a subspecialty that you may wish to pursue. So one of our trainees has chosen to do it in nephrology and is currently a fellow in the Hospital for Sick Children in Toronto. One of our other fellows has chosen it to do in hematology. So after that, there'll be a 3-month period in neonatology as an SPR equivalent with supported on-call. And this is for us, at this stage, moving from the second year up to the third year of training is a big step in responsibility. So we want to maximize the support we're offering to people on that journey up so they're not feeling overwhelmed. And the last 6 months are spent as an SPR equivalent in your base hospital. In this role, you are the link between the consultant and the SHOs, and you're also the senior decision maker on call with consultant support. This is the experience where you get to utilize your skills in decision making, putting together treatment plans, and being able to sift out those undifferentiated presentations on call, which for us is extremely important. So what are the requirements? They are, as Professor Cherian has said, post-internship, competency in the English exam, and the Part 1. I would really like to stress that the importance of the Part 1 is important because we have integrated this program into our basic specialist training program group, and most of our trainees will get their Part 1 within their first 6 months of pediatrics. So it can be a difficult, challenging thing to do, but we have an action plan around that. I would reiterate what Prof. Cherian has said with regard to the successful interview. There needs to be time putting into the application process and looking to say, am I selling myself appropriately? And what am I telling the person about myself? And I think this is really important. Obviously, there must be a desire to sort of relocate and to move to Ireland in order to undertake this program. So the supports that we have are very significant, and it has been reiterated several times, but we have a specific tutor for parts 1, 2, and 3. Now, amongst our basic specialist trainees, they're always surprised that the international graduates are getting such support and they're not. And this is because we've prioritized your learning, and we want to ensure that we maximize your ability and maximize your skill set in the clinical learning environments through this tutor support. The attendance at the BST training days are extremely popular, and it allows you to integrate with our trainees, of which we have in the first 2 years approximately 104. Attendance at the BST tutorials is also available, and these tutorials are specifically put together in order to get those professional skills that one requires to practice within the hospital environment. And has been mentioned, the e-portfolio again is paramount because this is a reflection on what you have done, and it is showing to your trainers and to me as a program director how much you've progressed over a period of time. So as you probably know or may not know, Catherine, if you just move to the next slide, So this is where you'll be training when you move to Dublin. Currently in Dublin, we have 3 children's hospitals, but this is the new children's hospital, which will be opening hopefully in April 2026. And for most people, this is where they'll be working for a significant period of their rotation. Okay, I'll be pleased to take any questions afterwards. Thank you.
Thank you very much, Professor O'Neill. And that was brilliant. And I would like to welcome now Professor Cecily Quinn, who will be talking about the International Basic Specialist Training Program in Histopathology.
Thank you very much, Katerina, and good morning to all of you from Dublin. So as Katerina has introduced me, I'm going to speak about the Basic Specialist Training Program in Histopathology in Ireland, which is overseen by the Royal College of Physicians of Ireland. So before I actually start on my slides, just to reiterate what has been said about entry requirements, they're very much in line with what Katerina outlined earlier in her talk. To qualify for the program in histopathology, you need to have completed satisfactorily your internship and of course be eligible for registration here on the trainee division of the Irish Medical Council. While one doesn't necessarily have to have any prior experience in histopathology or indeed in any other specialty prior to starting a residency program, it is an advantage certainly to have some clinical experience. Many of our own trainees before starting a career in histopathology do a general medicine rotation or perhaps a rotation in paediatrics or surgery or any of the specialties, and that is confirming and improving one's clinical knowledge following internship and experience certainly stands you in very good stead for a career in histopathology. So just briefly then, the Basic Specialist Training Program in Histopathology in Ireland is a 2-year training program. Now at the moment that training program is delivered in 4 different regions, and you've seen a nice video of Ireland earlier, and 2 of these rotations are actually in Dublin. We have the South Dublin rotation, the North Dublin rotation, and then we have a training program in Galway and also in Munster, which is in the south of Ireland, and that rotates between Cork and Waterford. So our trainees are assigned to one of these rotations, but also rotate between rotations. So it's possible that somebody does a year in South Dublin and then a year in North Dublin, or a year in Galway or Munster. So there is interchanging between the various rotations. Now, just to say that anybody coming, from the Middle East, we tend to place them in one city. So we feel that it's enough of a culture shock and enough of an acclimatization to get used to living in one city. So we don't expect people perhaps to go, from Dublin to Cork or from Dublin to Galway. So you would be placed in one city. So the next slide there, please. There's my map of Ireland. Thank you. So just a little bit about histopathology. The whole specialty of histopathology has evolved dramatically, really, in the last 50 years. Many years ago, histopathology was very much about looking down the microscope, coming up with a diagnosis, producing a very nice descriptive report. And it did impact on clinical care, certainly, but usually it meant that if somebody had a diagnosis of malignancy, they proceeded to have surgical excision. Now, histopathology and its allied molecular pathology really underpin medical care, in particular medical oncology. So without histopathology, really the treatment of cancer would not be able to proceed. So histopathology really is the center of medical disease management, in particular with regard to the management of cancer. So we, broadly speaking, consider histopathology in really 3 main categories. First of all, there are the principles of diagnostic surgical pathology. So by surgical pathology, we mean the study of tissues. So we may get small biopsies. So somebody has a breast lump, for example, and they have a little piece of tissue removed, and then we make the diagnosis in histopathology, and then the further management is decided. And then if somebody does proceed to have surgery, we get resection specimens, and there are a series of protocols developed to deal with those specimens. So as a trainee then in histopathology, as a resident, you will learn the principles of diagnostic surgical pathology. So first of all, you'll learn how to examine specimens in the gross room, and you decide what pieces of that specimen need to be sampled for further evaluation. Then you learn how to evaluate these under the microscope. So you review a series of slides. And then the way we operate our training program is you look at your slides and then you bring them to your consultant histopathologist, and then you do what we call the sign out. So you review the case. So that then leads to a compilation of a clinically focused, meaningful report. And as I said, there is a series of information points that are required for each histopathology report. So if you're dealing with colon cancer, there's a certain suite of information that's necessary. And for breast cancer, that's going to be different, and it's going to be unique to breast cancer. So it does depend on the particular type of specimen. You will also learn about new diagnostic tests, and in particular molecular pathology tests that are now being used to further inform specific cancer treatments. So most of our time is spent on surgical pathology. Now, you will also learn about cytopathology, in particular non-gynae cytopathology, and this is when a sample of fluid, for example, is taken from something like it might be a pancreatic mass or a thyroid mass or whatever. So you learn how to examine those slides and how to formulate a diagnosis. So that goes hand in hand with surgical pathology, but is a smaller part of our job. Then as pathologists, traditionally, we also do autopsies. And this is, of course, the art of post-mortem, trying to establish the cause of death in patients who have perhaps died suddenly or died following an operation, or following or died without the precise cause of death being known clinically. And now, not everybody chooses to do autopsies, and certainly the residency program can be tailored according to your needs to include autopsy pathology or otherwise, depending on your particular training requirements. So next slide, please, Katerina. So all of this then really, as I said, converges on clinical care and underpins good clinical care. So as part of this, then we have multidisciplinary team meetings for each of the specialties as part of our daily work. And I've just come from our breast MDT, which we have early on a Friday morning. And that's also part of your training and service delivery. So as trainees, as residents in histopathology, we will introduce you to the multidisciplinary team. So you're not just working in histopathology, you're working with your clinical colleagues, be they physicians, surgeons, medical oncologists, radiation oncologists. And you will learn then really to understand and appreciate the central role of diagnostic histopathology in clinical care, and the importance of collaborative and integrated modern medicine care, which really is today's form of medicine. Now, during your residency, you will have the opportunity to attend these multidisciplinary meetings and to present the histopathology findings and to partake in the discussion. Next slide, please. So that's all of your experience and training, which takes place at the hospital site, and that is, of course, the core of your training, and that's what you're trying to do in the course of your training to become an accomplished histopathologist, so that you can deliver a high standard of care. This then is complemented and supplemented by formal teaching. So formal teaching in the program takes a number of different forms. First of all, there's in-house structured teaching. So at each training site, you will have teaching slide sessions. There will be journal club, where residents will present an article from a journal and critique it, and there will be discussion among the wider group as to the significance of the findings. Then we also deliver formal lectures at the hospital sites. Then we have the RCPI National Study Days, and today is a histopathology study day, so many of our trainees are actually attending the RCPI study day today. So they, generally speaking, follow a theme, and the themes are going to vary throughout the year. In addition, then we have the RCPI mandatory courses, and these are courses in ethics, core pathology skills, audit, and quality assurance. So all of this then goes hand in hand with your on-site clinical training in histopathology. So next slide, please. So in terms of a training plan, then, if you were to take a post as a resident in histopathology here in Ireland, you will have an assigned trainer. So whatever site you're working at, a trainer will be responsible for overseeing your training. You will also, of course, be trained by all of the other consultants, but you'll have a specific allocated trainer. So at the start of your residency, then you will have a meeting with that trainer, and this will be to review your progress to date or your experience to date, and to designate, to formulate a training plan and to plan your goals for that particular training period. Then you will maintain a record of your experience, of the cases you report, of the journal clubs you attend and present at, and you will enter these onto your e-portfolio. Then if for example, you're in a particular site for 6 months, you will have a midterm meeting to review progress, and then you will have another meeting at the end of the training period with your designated trainer, and that will be to review your training record, to assess your competence, experience gained, and the completion of your goals. And then you will also then have an annual review, which is conducted by the Royal College of Physicians of Ireland, and this will be carried out by the National Specialty Director, who oversees the training in the whole country, or the clinical lead for the particular specialty, in this case histopathology, and also by your local trainer, who will send a report into the college, and that will form part of your annual review to assess your progress. Now, there are no actual exams that you are required to do during this period of your during your residency program. The exam that we do is the Royal College of Pathologists exam in London, and this has a part 1, which is a theory exam, and then there's a part 2, which is a very much a practical exam assessing your competence in all areas really of histopathology. So unlike other specialties where the fellowship or membership is done early on in training, we refer to our final exam as an exit exam. So generally speaking, our trainees do the part 1 usually in about their 3rd year of training. So many of our trainees do not do their part 1 until they start on higher specialist training. So some do it towards the end of their basic specialist training, which would be your residency equivalent, but many do not do it until they commence higher specialist training. And then they do the part 2 exam towards the end of their training, perhaps when they're in about the 5th year of training. Now, there's also an exam called the CHAT exam, which is the autopsy exam, and our trainees are currently required to do that exam, and they usually do that somewhere in between part 1 and part 2. So next slide, please. I think this might be my last slide. So in terms of the examinations, that's the outline of the exams. And so in the course then, other opportunities that you will have in the course of your residency would be, as you've heard from Professor Cherian and Professor O'Neill, opportunity to participate in audit projects, research studies, and hopefully to present your findings, be it a poster or a paper at local, national and international meetings. So although you might not sit your FOC Path Part 1 until after your basic specialist training, you are of course encouraged to prepare and possibly sit that exam, but not necessarily, but certainly to do focused preparation. And then, of course, following satisfactory completion, which is very much based on the assessment of your progress during your residency program, you can apply for further training in Ireland or abroad. I think Professor Cherian showed a very nice slide on the kind of people, we like to attract, and that's very much the same in histopathology. There was a perception many years ago that pathologists spent all of their time sitting up in the laboratory, looking down the microscope and didn't interact with anybody else. That has certainly, hopefully, been dispelled, that impression of pathology. We are very much now, part of the wider clinical team. So good communication skills, ability to communicate a very clear, focused report. These are essential skills for a histopathologist. It's also very important to have good organizational skills and to have good attention to detail. And above all, I think pathologists very much have a love of learning. It's certainly every day is a school day, as they say, and certainly that thirst for knowledge and that desire really to figure out what exactly is going on with a particular patient to try to optimize their care is a quality that we certainly respect and encourage in histopathologists. If you have any questions that you would like to ask, please feel free to email me or to contact me via Katarina at the RCPI. So I think I'll finish there, and thank you very much.
Thank you very much, Professor Quinn. That was really insightful. And now I would like to welcome Dr. Azrini Khalid, who will be talking about the International Residency Training Program in Obstetrics and Gynaecology. Oh, apologies, Dr. Khalid, you're still on mute. So,
great.
Yeah, brilliant.
There you go. Yeah, perfect. Sorry. So my name is Azzy Khalid. I'm one of the NSDs in the basic specialty training program in obstetrics and gynecology with the RCPI, and a consultant obstetrician gynecologist in University Hospital Waterford. So just, I suppose, briefly to kind of give an overview of what the training is like in Ireland, and a bit through the BSc and IRTP curriculum. So these are the International Residency Training Program curriculum very much mirrors the BST curriculum in obstetrics and gynecology. Just a few little courses and study days that some of them will be mandatory where you're expected to attend, and then there are many, many study days that will enhance your learning as well while in Ireland. Examinations that we expect you to successfully achieve, what the certification process is, and then where the prospects from completion of IRTP brings you afterwards. Next slide, please, Katerina. Thank you. So the typical training in Ireland, so I suppose before going into that, again, just echoing what all the professors had said before myself with regards to making yourself competitive for the application process, really, and really in your application form, showing your interest in the specialty. And so typically in Ireland, you have 1 year of internship, which may or may not include obstetric and gynecology, to be honest. And then you have the opportunity to apply to the various basic specialty training schemes under the RCPI. And again, the IRTP is expected to, it is directly mirroring the BST program in Obs and Gynae. So in Obs and Gynae, it is a 3-year program. So 2 years, which includes 2 years as a senior house officer. So this is equivalent to a resident, and 1 year as a junior registrar. The reason that we have a 1 year as a junior registrar included into the BST program or IRTP program is because in obstetric and gynecology specifically, it's such a huge jump between your responsibilities as an SHO and a responsibility as a registrar, independently managing a very busy labour ward or delivery suite. Hence the inclusion of a junior registrar year onto the BST to better support that transition, I suppose. And then following completion of the BST, most people would endeavour to go into the HSD, which is a 5-year minimum. The first 3 years are semi-regionalised, and then after that you have the option of doing an out-of-programme year or years, which will involve either subspecialty training or maybe postgraduate degrees such as an MD or PhD. And then the final 6 months has to be in Ireland before sign-off for CSESD for your consultancy. Next slide, please, Katerina. Great. So with regards to the curriculum, you'll find this on the website, the IRTP in obstetrics and gynecology. And again, this very much mirrors the BST curriculum. It's outcome-based. It's an outcome-based curriculum. So there's a number of assessments to demonstrate your competency in specific procedures and specific case managements that you will need to sign with your trainer or ONG assessors. The next slide, please, Katerina. So this is just a demonstration of what is in your curriculum, basically. So there are 8 goals, and each goal has outcomes within them. So, for example, a very basic one would be basic general and clinical skills in the goal, and the outcomes is you kind of demonstrating that you can take a history and do a basic gynecological examination, and this has to be signed off in with your trainer. So again, each of these goals have a list of outcomes to achieve. They will all be in your e-portfolio. You'll need to sign them off with your trainer. You'll have a a quarterly, you should be arranging a quarterly meeting, I suppose, the start of your rotation, to agree on a goal plan with your trainer, and then you have a quarterly assessment with your trainer to ensure that you're meeting your goals. And at the end of the year, another assessment with your trainers as well as the NSDs, to ensure that you're meeting your goals for the year. With this being outcome based as well, there's specific goals that you be expected to achieve by year one, specific goals by year two, and then by the end of year three, the expectation is that you'd be able to manage a busy labor ward, relatively independently with support of your consultant that may be off-site. So next slide, please, Katerina. So this slide just demonstrates all the outcomes within each goals. And when you look through your curriculum handbook, there'll be specific assessments that are required for each of these goals as well. So this is in the handbook anyway, and it's accessible on the RCPI website. Next slide, please, Katerina. Great. And again, I mentioned earlier that there'll be some mandatory courses and also various study days in person and online that you can attend. And that's just a QR code, I suppose, if you wanted to kind of, that'll lead you to the list of mandatory courses in the obstetrics and gynecology curriculum. Some of these are online, and some of these will also have an in-person element where we try to do blended learning as much as possible. You have all the theoretical elements online, and then you'll have days where you need to attend to have some hands-on experience. And this will include a basic practical skills in obstetrics, and then another day with basic practical skills in gynecology, which includes the ultrasound as well. And then prior to BST year 3, there's also a junior registrar course, essentially, really, where we go through all the essentials that you need to be equipped with prior to progressing as a junior registrar in BST 3. Next slide, please, Katerina. So again, just to demonstrate the numerous study days that are available, and with loads of opportunities for you to be involved in audit and research and present at these study days as well. And next slide, please, Katerina. With regards to professional exams, I suppose in order to be eligible to start the IRTP in obstetrics and gynecology, having the IHE diploma in obs and gynae is a requirement. And the reason that this is a requirement is because completion of this will equip you with at least the basic knowledge clinically to work in obstetrics and gynecology, because many of you may not have had experience prior to this, but at least doing the diploma equips you with the knowledge. With regards to professional exams moving forward, the diploma in obstetrics and gynecology by the RCPI is now recognized as an equivalent to the MRCOG Part 1 to enable you to progress to MRCPI Obs and Gynae Part 2. So for the MRCOG Part 1 and the diploma in Obs and Gynae and RCPI can be done during your internship. So there's no kind of time restraint on that. And again, I suppose even an attempt at these exams is a demonstration of your interest in it as well. By the end of the IRTP or BST, you're expected to pass the MRCPI Obs and Gynae Part 2. And this is a requirement for you to receive your BST or IRTP certificate. The MRCOG is not a necessary exam for BST or even HST. However, it does open up many, many more opportunities for you to work abroad as well. And it is also kind of well-established exam in Obs and Gynae. And next slide, please, Katerina. So again, I mentioned earlier to receive the IRTP or BST certificate, you must have the MRCPI, Obstetrics and Gynaecology, and also there'll be an assessment of your logbook where there has to be completion of the logbook as per the curriculum requirements, and all this will be in the curriculum handbook. Next slide, please, Katerina. With regards to career progression, I suppose it is equivalent to the BST, and it allows you eligibility for HSD application and also consideration for fellowships elsewhere as well. I think that's it, really. Thanks very much. And any questions are welcome.
Thank you very much, Dr. Kali. That's brilliant. I believe that we close off our talks, and thank you so much for all our clinical leads who were able to attend today. We are slightly behind the time, but we will do a short question and answer session. So I would like to welcome back Karina, who will look after the question and answer session now.
So thanks, Katerina, and thank you to all our presenters. That was really informative, very interesting. I'm still always learning more about the programs. So Katerina has the details there if you have any questions. I know we've answered a lot of questions live, but there's some of them that I think will be useful to have our clinical leads here answer. So the first one maybe for Professor O'Neill. We have a candidate who has completed the entire MRCPI in Paediatrics, and they're wondering, could this help shorten the duration of their residency training program?
Okay, that's an excellent question. So the answer is no. So this is really a clinical program, so that if you want to progress, say, to North America to do a fellowship, they would require that the full 3 years would be completed. And in fact, having got the exams now would be excellent for that particular trainee, but it won't shorten the program.
Great, yeah. And Professor Cherry, and that would be the same, of course, for internal medicine as well.
Yes, that's correct.
Great. And then for Professor Quinn, we have a question. Is chemical pathology considered a subspecialty or rotation within histopathology?
No, it's not. Histopathology is one of the disciplines of pathology. Chemical pathology then is a separate discipline. So the histopathology residency program focuses exclusively on histopathology training. All of the pathology specialties, all 5 or 6 specialties, all have different training pathways. And for doctors, they don't rotate between them.
Great, thank you. And then just another question that I might just put out to all our clinical leads. A few people have asked if there's a gap in their clinical experience due to, personal matters or potentially taking time off to do a master's or a PhD, will that negatively impact their application?
Well, perhaps I'll just start. For pediatrics, the answer is no.
Great, nice and simple.
Yeah, likewise for histopathology, no, and certainly doing some research is a benefit. It's certainly not a disadvantage.
Yeah, I'd echo the same sentiments. I would just say that it depends on how long as well, and what the purpose of the break was. As Prof. Quinn mentioned, if it's to advance research or a thesis or something like that, absolutely. But if someone's out of clinical medicine for a number of years, that would definitely raise a question that would have to be further addressed. Yeah,
agreed.
I'd echo everything that was said earlier. Again, if it was a career gap that demonstrated, if you're doing a PhD or MD where it's relevant to the career, then it shouldn't affect the application. If anything, it'd be strengthening the application. Yeah.
Great, thank you. And another one for Professor Cherian. Is research experience mandatory for the internal medicine residency?
Does that mean to get onto the program or during the program?
I think they mean to get onto the program.
No, it's not mandatory. It's always a positive thing to have evidence that you've had some exposure, but it is not a prerequisite that you have to have had research to get onto the program.
Okay, great. So that's kind of it for the main ones. I know we've gone slightly over time. There's just one or two ones that I might answer, just about sponsorship. You do need to be sponsored by a government body or a public hospital. So we don't take self-funded candidates or, funded from a private hospital. That's not how the agreement between the countries are set up at the moment. And then also just one final thing, each year before people start in their clinical placement, we have an induction, and we really encourage you all to come in time for that. It gives you an opportunity to meet your other colleagues and learn more about the college and what's in front of you in the training as well. So I think if there's any other questions that I know myself, you attend these webinars and you walk away and questions will come to your mind then later in the day, please do reach out to myself and Katerina. If we can't answer the questions ourselves, we'll contact the clinical leads and come back to you ASAP. So just want to say thank you again for everybody that joined us from the Middle East, and also a big thank you to our panelists for the great presentations today. And hopefully, we'll all meet in person in Ireland at some stage when people start their training. So have a lovely day, and thank you to everyone, and Denise and Adam as well.